talking about my treatment process. So when I'm applying my treatment process to a patient, it allows me to apply a very scientific approach to figuring out a patient's complaints. When I have a patient here, and I'll just do a general muscle test on her, she can bring this arm up, come this way, push towards me. Okay, so that's a strong muscle. I want to see if I can do something to her body or expose her to something or do something that can provoke a change in that muscle. So in her case, if I had her sniff an inflammatory chemical like bleach, this muscle, come this way, that goes weak, okay? So basically, I started off, I had a strong muscle, she sniffed that muscle turned off. It's strong right now, but if she sniffed that chemical again, it would shut off. That just tells me that her nervous system responded to that stimulus. And because of that response, then I got to try to figure out, well, why did that happen? And if I can figure out why that happened, and I make the correction, then I kind of will do the same process over again. So every time I apply a treatment to somebody, I have to reevaluate them after every single treatment that is applied, because the nervous system is constantly adapting. So as soon as I apply a treatment to someone, what showed up on the person at that point in time will change. And we need to kind of reevaluate things at each point along the process. So basically it's start with a strong muscle, or just start with a muscle. You want to test it. You want to see if you can get a response out of that muscle. If you don't get a response out of that muscle from whatever you're challenging your body with, you move on to something else. If you do get a response, you want to figure out why that happened. If you figured out why that happened, you apply the treatment, and then you kind of do the same thing over again. Just start over again. And that's basically the treatment process.